By proceeding, you, the viewer, have read and agree to the following disclaimer. Hi, I'm Dr. Jill Krista with my webinar series on infection-induced encephalitis, coming to you as a fellow Pandas Pans mom and a licensed naturopathic doctor. We're in the second series now. Last series was on fundamentals, and now we're going to be covering all the things you need to know for the immune system, the foundational support things that you do in conjunction with conventional care to get the best that you can out of your care. Okay, running through the immune system very quickly. Hope you're keeping up with me. Going over vitamin D, probiotics, vitamin C and bioflavonoids, antifungals, antivirals, and then other immune insults to consider, because I saw at the conference there were a lot of kids that I think probably had other infections that were going on in addition to strep, and I think managing those helps to reduce the infection-induced encephalitis. So on to vitamin D. So many things to say about vitamin D. It's an immune modulator. A lot of people say immune stimulator, and then we worry about that with autoimmune disease. So I want to rewire that or redefine what immune modulator means. It means it boosts or builds the immune system without increasing autoimmunity, and actually can be found to reduce autoimmunity. So a deficiency may cause a neurotransmitter imbalance in the brain. The body or the brain has two types or families of neurotransmitters. There's excitatory and then inhibitory. Adrenaline rush versus calm, that kind of thing. So if you are low in vitamin D, you can tend to have more excitatory neurotransmitters like dopamine. Vitamin D early in life, an adequate vitamin D level can reduce food allergies, so then you're less diet restricted. And vitamin D downregulates that IL-17, which therefore downregulates or lowers the Th17, which is involved specifically in pandas' basal ganglia degradation and swelling and attack. It also reduces tumor necrosis factors. So a lot of you out there are parents and doctors. That's how you got into this. So I put in some geeky doctor stuff in here and a lot of studies at the bottom. I wish they were all human studies, but in natural medicine, we don't have the budget for that. So most of them I tried to find either a mouse or a rat study. It also lowers chemokines in the brain, and there are specific chemokines that are related to Sydenham's chorea, which probably are related to pandas. I think it should be called hormone D because it also regulates the whole endocrine system. If you're low in vitamin D, you can see low thyroid and you can see low sex steroid hormones in your kids. I dose to a lab goal of between 60 and 80 nanograms per milliliter, and if you live in Canada or another country, you might have different units, so make sure you're looking at those units and you do the appropriate conversion. And a lot of these kids need an emulsified form because they don't, because of the food and restriction issues and gastroparesis, if they have Lyme as well, they don't make really robust digestive juices, and this is too important of a nutrient to just throw down as a pill and hope that it's working. So make sure you monitor lab, and if you're not seeing that lab go up with a good hearty 5,000 IUs a day or something like that, try switching form. Okay, on to pre and probiotics. Hope you're keeping up with me. The probiotics specifically are immune modulators as well. They boost the immune system without making autoimmunity worse. And in naturopathic medicine, I was trained that if you want to seal up the blood-brain barrier, you seal up the gut barrier. So probiotics help with managing the gut function and gut barrier. Probiotics specifically inhibit that pro-inflammatory cytokine Th17 that we hear a lot with pandas, and it shifts the T helper cell response to a more supportive immune response. Now remember, the bulk of our immune system and the bulk of our brain neurotransmitters are made in our gut. So you have to manage the gut if you're going to get anywhere with this condition. Prebiotics reduce anxiety via a serotonergic activity, so they help boost serotonin in the gut, and we see that it actually must help somewhere in the brain because it reduces anxiety in the brain, anxiety symptoms. I would say typically go for refrigerated strains. There are some exceptions to that, that's why I have a star there. But if you have a refrigerated strain, it's going to be viable cells, not just dead cells that you're putting in there. And I encourage people to avoid strep strains, strep thermophilus and that kind of thing. We don't really know what is the antigenic part of the strep pyogenes that the body is cross-reacting to. So since we have options to stay away from them, I would just recommend if you have a PANDAS PANS AE kid, stay away from designer probiotics that have strep strains in them for now. But definitely look for those that have prebiotics like FOS. And then dose in the billions, and if your kids are on antibiotic therapy, make sure you're avoiding antibiotic time by about an hour either way. Vitamin C I put on here because I feel like it's one of the great forgotten immune aid nutrients. And again, these kids are on really restrictive diets often, and so you need to get that vitamin C in somehow. So I would recommend supplementing and add bioflavonoids so that it has all of its own nutrients that it needs to do its best work. I dose this frequently. It's water soluble, so you can pee it out if you don't get it, if you've got too much. And so there are no toxicity problems with vitamin C. The only thing you'll see is a little bit of a loose stool if you're going too high. So just back your dose a little bit. There are IV options, so make sure you're testing for G6P deficiency before that. Otherwise, you can cause hemolytic anemia. So if you have a doctor talking with you about that, make sure you're getting a G6P test first. Antifungals and antivirals. I think that everyone who's ever put on an antibiotic needs to go on an antifungal. I am a mold educator, and mold and candida and these fungus are very tenacious. And if you handle it from the get-go, it doesn't have to become a problem that you're dealing with and having to use a heavier hand later. Fluconazole is often used for my patients and for my kids. We use it in a pulsed fashion, 100 milligrams or 200 milligrams daily for 3 days to kind of get a handle on it, and then you can pulse it 2 to 3 times a week to just stay on top of it. Nystatin is also effective, so if you do worry that you have a candida kid, you could do cultures and a culture and sensitivity and see which one would work better. Herbals have a lot less side effects than the prescriptions, so that's my go-to personally for myself and my family. These are some of my favorites: olive leaf, thyme, powder arco. Old man's beard is usnea, and spilanthes and garlic. You can add garlic to eating and help stay on top of that fungal overload. I put antivirals on here because most of the PANDAS kids that I see have some sort of chronic viral load, especially if fatigue is a problem. So I put some of my favorite, what we call innate boosting or cellular response boosting plants on here. There's astragalus, larch, aloe, melissa, and then licorice. Go soft with the licorice though, because while it does help to manage the dopamine balance in the brain, it can lower testosterone and estrogen in boys and girls over time in too high of a dose. So just rotate that one. Other considerations, other immune insults. When I was talking with the parents at the conference, I heard a lot of, I wonder if this is Lyme disease. And then what about co-infections that can affect the brain and brain function, like Bartonella, Babesia, Mycoplasma, Varicella, or the whole herpes family can affect the nervous system. Coxsackie-B is a potential inducer for infection-induced encephalitis or an aggravation of that. And then good old mold. For our family, a toxic mold exposure was the thing that caused the worst and so far the only major aggravation that we've had with this condition since we started treating it. And it's taking months to get reset from that. So definitely check for mold, put it in your thought process. And then low immune globulins. This might be congenital or it might be acquired by having food sensitivities and eating them anyway. Okay, so, back on the other considerations. If you think Lyme is a problem, I would highly recommend going to see a Lyme literate doctor. The testing is not good for Lyme. It still is a clinical diagnosis according to the CDC, so make sure that you're seeing somebody who has some experience.